Hello, and thank you for tuning in. Today, we are going to be talking about pain management for multiple sclerosis. This is such an important topic because I think that pain in MS is not discussed often enough. It's often attributed to something that is not MS related, and therefore you don't get the care that you need to actually recover from the pain that you are feeling. So today we are going to review some of the most common symptoms and definitions of what type of pain is common in MS. The reason this is important is because if you have pain and you can establish or determine that, yes, this is from multiple sclerosis, not from something else, then you can start taking action and seeking out the guidance you need to help recover from this pain. You don't need to live with these pain symptoms, whether acute or chronic. So my goal for you today is that you can understand a bit more about what type of pain is associated with MS. I will also be posting a video next week where we will be going into the treatment options for MS-specific pain management. So after listening to today's video, if you feel like you do have pain that may or may not be associated with your MS, come back next week to learn all of the treatment techniques. Pain is one of the most common symptoms in multiple sclerosis. It's almost up there with fatigue. And fatigue, as you may or may not know, is thought to be present in 85 to 95% of people with MS. And similar to fatigue, pain can be present in people with MS on varying levels. It can be really severe, it can be chronic, or it can be mild and come and go. So it is different, but there's lots of different types of pain that is important to know about, and it's important to be aware that it can be associated with MS so that if you are feeling pain, hopefully you can seek out guidance from your neurologist or physiotherapist, physical therapist, occupational therapist, anyone on your healthcare team. Pain, as we were just talking about, pain can be present in 2/3 of people living with multiple sclerosis at some level. Again, that could be chronic, it could be acute, it could come and go, it could be severe, it could be mild, but some level of pain. And over half of those 2/3 of people are affected by chronic pain at some point. So we're going to go into the different types of pain so you know what chronic means, what acute means. Some of these words that I've just thrown out there, you'll hopefully have a good example, an idea of what they are. So different types of pain. Acute pain is sudden onset, typically. It's inconsistent. It can be caused from an injury, surgery, illness, or trauma. And one thing I think is important to discuss in MS is that just because you have MS, it doesn't mean that you won't also get orthopedic conditions. And sometimes we think everything is related to MS, and sometimes it might be. But if you have MS, you could still need a hip replacement, which is an orthopedic thing. You could still get shoulder pain or back pain, and it's orthopedic. So acute pain typically is more associated with orthopedic type injuries, or traumas, or even illness, or if you were to fall, that would be a type of acute injury. So it's a sudden onset and inconsistent. It doesn't last too long. And what I mean by that, I should clarify. What I mean by that is it could last a few minutes, it could last a few days, it could last a week or so, maybe even a few weeks, but typically not longer than that, depending on what's causing the acute pain. Now, chronic pain is a different type of pain. So chronic pain is more consistent, and that is one of the biggest differentiating factors. So that consistent, this is something that may change levels. It might go from really severe to less severe or moderate to mild, but it's always there in some way, shape, or form consistently. So we're talking over months or maybe even years. So it can be long-lasting, it can be caused and or worsened by stress and anxiety. And this is a double-edged sword because if you're in chronic pain, who wouldn't be anxious and who wouldn't be stressed, right? We want to reduce the pain, but not knowing what to do or not having strategies that have worked can make your stress and anxiety worse. So definitely a tricky one here, but chronic pain, we're thinking long-lasting, more consistent. Acute pain, we're thinking more inconsistent and more sudden. Types of pain sensations. So there's so many different types of pain and sensations that can come around with multiple sclerosis. And it really just depends on what you view as pain versus sensation. So I wanted to include both of them here because for some people, pain is pain. Sensations are numbness, burning, pins and needles. But for others, numbness, burning, pins and needles, that is a form of pain. And so I wanted to make sure we talked about both of those today. That way, hopefully all listeners will feel heard on their type of pain that they're feeling. So various examples of pain and or sensations are burning, pins and needles, numbness, tingling, bugs crawling is one I hear quite frequently, like bugs crawling underneath your skin, tightness and electrical shock, stabbing, shooting, or radiating. And again, some of the time, these types of symptoms can be caused from orthopedic injuries, like if you have a pinched nerve somewhere, maybe in your neck, maybe in your back, your hip. Really, pinched nerves can happen anywhere. They can even happen from tight muscles. So if you have really tight muscles, you might be having some of these symptoms. It's totally unrelated to multiple sclerosis, and we would do more orthopedic type exercises. Or it can be directly related to multiple sclerosis. And the way to figure that out really would be to see a physical therapist or maybe your neurologist. PTs are usually the ones that are able to differentiate that for you. So moving on to different types of pain, there's lots of different examples. I chose some of the most common ones here, but there are others. So if you are feeling pain and you don't hear me say the type of pain that you are feeling, please know that that is also justified and validated, but these are some of the most common ones. So the first is allodynia. It feels like light touch is painful. Like if someone just rubs your back, let me be like a very soothing way, or they just tap your shoulder because they want to get your attention. Light touch often feels painful with allodynia, even though that light touch shouldn't cause pain. So if you have that type of sensation or pain, you now have a name for it. So it's allodynia. Paresthesia is another really common one. And this is where it's an annoying, unusual sensation like tingling, numbness, pins and needles. It may be triggered or just happen spontaneously. So it could be triggered also from touch maybe, but it's specifically the numbness, tingling, pins and needles, not just, ow, that hurts. So it's more of the sensory type of pain versus actual, what we normally think of when we think of pain. And again, it can be triggered by someone touching you. It can be triggered by stress. It could be triggered by a tight muscle. Or it could just be spontaneous. We could be sitting here, you could be watching this feeling totally fine, and out of nowhere, your hand starts feeling numb. So that might be something more paresthesia related. Next is dysesthesia, which this is typically more intense than the other two that we've gone over so far. So it's more intense, it's sometimes painful, and it often happens spontaneously. And spontaneously sometimes could mean that there's a trigger. So for example, if I was sitting right now talking to you about pain, but I was sitting with really poor posture, like my shoulders are really rounded, my neck is maybe up like this, I might think it's spontaneous that my arm starts feeling pain or numbness or a certain way, but it's actually due to the position that I'm in. So again, it can be tricky to determine, is it postural? Like if it truly feels spontaneous, like, what the heck, I'm just sitting here presenting, why am I feeling this? It might seem spontaneous at first, but it actually was my posture. So we need to kind of trial and error this. Posture is usually the easiest thing to fix and one thing that can cause some types of pain. And so fixing your posture is the very first thing I recommend to all of the clients that I work with if you're noticing a sensation of pain. Similarly, if it's your leg, if it's not your upper body, if it's your leg and you're noticing numbness, pins and needles, tingling, pain. It could be the pressure on your glute muscles or your piriformis. It could be the pressure of the muscles that you're sitting on. So standing up would be a change of posture that might alleviate some dysesthesia or paresthesia. But dysesthesia is the one that's typically more intense. Neuralgia, you might have heard this one too. It's intermittent shock-like pain, and it follows the nerve path. So what that means is it's not just one area. It wouldn't just be your hand or just be your foot. More often than not, it's the full pathway. So you would feel it all down your arm or all the way down your leg. So that's one of the differentiating factors there. Extreme heaviness can be a source of pain, but pain and or sensation, more often than not, in my experience, heaviness is actually spasticity. And so even though it feels heavy, it feels painful, it feels uncomfortable, we wouldn't necessarily use pain reduction techniques or sensory reduction techniques for heaviness. We would use spasticity reduction techniques. So typically, anytime I've been an MS specialized therapist for 8 years now, I want to say, maybe it's 9. And 9 times out of 10, when heaviness is used, when that specific word is used, and then I test to see what might be going on, 9 times out of 10, it's spasticity. It's the tight muscle. So we would want to focus more on spasticity reduction versus pain. You could still try it. You might just notice less improvement. Other types of pain. Optic neuritis. So this is a pain specifically in the eye. It could be one or both eyes. Usually with multiple sclerosis, it's just one eye, but it can be both. But again, most often it's one. And this is pain that tends to worsen with eye movement. So again, if you're watching this presentation, you're focused on me right now, but then someone calls your name and you have to turn and look at them. Or if your phone is going off and you're trying to be really great and listening and not distracted, but you look over at your phone or you look at the time, you're kind of moving your eyes around. Maybe even it's your eyes and your head. You turn and your eyes and head are moving. Those types of movements typically make it worse. My clients who have experienced optic neuritis will typically notice it when they're driving, because driving is a very specific situation where we're looking around a lot. We were supposed to be forward, rear view mirror, side mirrors. And so that's where they might first notice it. And it typically is described as a dull ache behind your eye. And again, it can be one or both, but in MS, typically it's just one. Muscle spasm or spasticity. And so this feels like muscle tightness that doesn't let go. And also, as we just mentioned, it can feel like heaviness. Usually my clients that have spasticity and these muscle spasms, they'll describe it as if their leg or their arm, whichever area, body part is feeling spastic and in pain, they'll describe it as heaviness. They'll say, my arm feels like it has a 50-pound weight attached to it. Or my leg feels like it has an 80-pound weight attached to it. Or it could even be your whole body. I've heard several of my clients say it feels like I'm wearing a backpack that's filled with 100-pound weights. And so it could be a limb, it could be your whole body, but usually it's that heaviness. For spasticity, pain that comes from muscle spasm is usually more acute. And so just a quick review, acute was kind of come and go, inconsistent. With muscle spasms, they can come on, sometimes for a reason, other times for no reason, like restless leg syndrome. And then it goes eventually. With spasticity, it usually takes a lot longer to go away. Musculoskeletal pain is next, and this is the type of pain that we all get, whether you have MS or not. Musculoskeletal is something that everyone experiences. It's just musculo is muscle, skeletal is bone. And so we can get muscle and bone pain regardless of what other conditions we have. But typically this feels like muscle soreness or an injury, like you fell and your hip hurts, or you bumped into the wall and your elbow hurts or your arm hurts. And this is also typically acute and will go away. So one thing that I always like to understand and wrap my head around is why. Why is this happening? And specifically, if it's not musculoskeletal, if it's not orthopedic. If it's musculoskeletal or orthopedic, we typically know the reason why. As we've reviewed, it's you fell, you just are sore from an exercise that you did. We typically know the reason. But with MS, we usually don't know the reason. We fixed our posture and it didn't help. We might stretch and it doesn't help. We even go to an acupuncturist or a massage therapist. It doesn't help. Why is this happening? So with multiple sclerosis, when you're feeling pain that is not caused from something else, it's caused from the MS. The reason that is happening is because it's due to damage to the spinal cord. And that is very different than I bumped into a wall and now I have a bruise, or I fell and now my knee hurts. Therefore, it requires different treatment options too. So with MS, damage to the spinal cord, and when that happens, the brain cannot interpret the sensation, so it tries to relate it to something that you've felt before and that you already know how it feels. And so an example of this would be there's damage to your spinal cord. And so let's say you're walking and you step on a rock. It's not a painful rock, it's just a rock, rounded, smooth edge. You step on that. But your brain cannot interpret what you just stepped on because the neural pathway, the spinal that leads from the spinal cord all the way up to your brain is damaged. And so it's having a hard time interpreting what was that. And so instead of having your brain figure out, okay, was this a thumbtack that's sharp and painful? Was it a stone? Was it a leaf? Instead of having the time to figure that out, our brain just says, pain, something happened, ouch, and then we feel pain or numbness or whatever the sensation is, and it happens anywhere in our body. But that's the reason that it happens in MS. There's damage to the spinal cord, and because of that, our brain can't interpret what's actually happening. So most of the time that we're feeling pain from MS, there's not actual pain there. Sometimes there is, but most of the time, it's not that there's actual pain. It's that our brain can't interpret what's happening. Another example might be, I have this cold glass of water right here. I'm feeling the sensation of cold. But if I have damage to my spinal cord that can't interpret what sensation this is, I might think it's hot and I might drop it because it was too hot. Or if I can't sense heaviness, I might not squeeze enough and it falls through. And so this goes into lots of different types of areas. We're talking sensation, we're talking pain, we're talking strength, heaviness, but it's all goes back to damage in the spinal cord versus an orthopedic or musculoskeletal injury or something that's going on there. So there's no actual damage to your body part. For example, there's no actual damage to your foot, yet in the example of stepping on a stone, your foot is what feels painful. So no actual damage, you're just feeling this sensory change. The damage is in the nerve that reports to the brain. And in case this wasn't clear, 100% of the time, what happens is our brain then connects to our neural pathways that goes down to our muscles. So if I wanted to reach for my glass of water, my brain has to say, reach to the glass of water. Then the neural pathways have to say, okay, we're on board. Let's extend your arm. I extend my arm. So it's brain, neural pathways, muscle, the extension. But it works the same in reverse. So if I step on a stone, it's the muscle that has to travel, that feels something. It's the muscle or the sensory part of a nerve. It feels something, travels up the sensory nerve, and then goes back to the brain. So it's the same thing, just opposite. But because the neural pathway is damaged, the brain doesn't get the right sensation. So I think it's helpful to have that visual of the pathway and what's happening. Implication. So let's say you have damage to your spinal cord. And what I mean by damage is mainly demyelination. If there's something happening to your spinal cord or really any nerves, it could be your optic nerve as we discussed earlier. when you have damage there or demyelination, what can happen? Anything we've talked about so far. It can be numbness in your feet. It could be numbness in your hand, paresthesia, allodynia, dysesthesia, neuralgia. But what does that actually mean for you in day-to-day life other than, ow, this hurts, or, ooh, that's uncomfortable? It actually can affect you. And so as a physical therapist, I'm constantly looking at sensation and numbness and tingling and asking those questions of my clients, because if you have any type of sensory change in your feet, that more likely than not is going to affect your walking. If you can't feel your feet or you have pain in your feet, then every step you take forward, you might not know where your foot is in space, and it might land across your body and then you trip and fall. Or you might be taking really short steps because it makes you feel safer, but that actually could also result in a fall or tripping over your own feet. So anytime that the numbness or pain that you're feeling, tingling, anything is in your feet, walking can be affected. So it's important to assess that. You can have this pain that we're talking about in your torso, which would more so be the MS hug, which is anywhere typically from about your collarbone all the way down to where your hip flexors are. For some people, it's just higher up. For other people, it's just lower down. But either way, it's that tightness or pain, sensation, any type of sensation that we've been talking about so far, specifically in the torso, that is called the MS hug, and that can potentially affect your breathing. It can affect your mobility and your movement. If you're having any of these sensations in your hand, similar to walking, where if it's in your feet, it affects walking, if it's in your hands, it can affect grasping. It's shaking someone's hand, touching something. Again, I might feel this glass as being hot when it's not, or cold when it's not. I might not sense the heaviness, or it might be too painful to hold something that is this heavy, and so I drop it. And so if it's in our hands, then typically that would affect our day-to-day life with things that we do with our hands, even feeding ourselves, brushing our hair, things like that. Hot and cold is a different type of sensation and pain if you can't sense hot or cold. And you actually, well, there's two different types of hot or cold that we can discuss. One is sensation in our hands, our feet, our body, and that can be dangerous because if you don't really sense heat, you might have a heating pad on you and it actually leaves a burn because it was too hot and on too long. Or if you can't sense cold, you might have an ice pack on you and it leaves a freezer burn almost, but on your skin. So that's the damage that might occur, or the symptom that might occur when it's in our body, like on our hands or feet or any body part. But another type of hot and cold sensation that can limit us is actually internal, and it's temperature misregulation. And this temperature misregulation is when you feel hot, but no one else is hot around you. And you might actually start sweating. I've seen this from time and time again. So you feel like, oh my gosh, I'm dying here. But you're in a really cold room. Again, your body is not correctly interpreting what temperature actually is around you. And it can be the opposite. It might be other people might be dying hot, sweating, and you might be freezing. You might be literally shivering because your brain is getting the wrong message that you're cold, you better shiver to warm up, even though the temperature was actually hot. So for temperature in particular, it can be internal or external, and it results in different things happening. Thank you so much for tuning in. I hope you found this informative. And if you're looking for even more information and maybe even some MS specific exercises, feel free to check out some of my other videos, which you'll see here.